ADHD stands for Attention Deficit Hyperactivity Disorder and most commonly appears in children and teens. Dr. Himasiri-desilva of St. Joseph Hospital in Orange discusses the symptoms and treatments for this disorder.
Generally starts very early in life, and so the symptoms are picked up by the teachers mostly when they are not paying attention to what's going on, and they're impulsive, their behavior is not like the others, they are hyperactive, going from one to another, they are unable to finish a task. I'm describing a very obvious case of hyperactive disorder, but there can be very milder forms. Many people can live with little bit of attention deficit disorder, and they go through life, they go through even advanced training with that without any treatment, but the obvious ones are where you can see their impulsivity and poor concentration. Many people who exhibit ADHD symptoms very young, by the time they become 18, sometimes they are diminished at least, and some people overcome that, so they grow out. This is a condition where you have to involve the other members of the family, like your parents, and what they see. Since it's a brain disorder, it is not just limited to the school. It has to be there 24 hours a day. Of course, discounting the sleep, all the other times. So the parents' input into this is extremely important, and so you have to gather the information from the teachers, from the people who know the child. There is some familial tendency for ADHD too, just like the bipolar disorder. You can have other members of the family having the same problem, and the amount of suspicion goes up. If father has ADHD or mother has ADHD, not many difference between the boys and the girls. Unless the person has suffered a motor accident, head injury, there is no adult onset ADHD. They all started very young. You have to evaluate whether they need to be treated with medication, number one. That is determined by the amount of destruction or disturbance there is in the person. If it's a milder form, by avoiding certain things like diet rich in carbohydrates and avoiding the stimulants for the patient, you can control some of the behaviors. But if it is very disruptive and it's disturbing their education and things like that, you have to select a medication that will control the hyperactivity and increasing the attention. It's very crucial because that's the formative years, and then the education depends on what they can absorb. So it's extremely important to pay attention and consider treating them aggressively to control it.